was December 13th, was admitted and was in for 115 days.
I did not have issues beforehand.
I had a lot of problems during that time as part of COVID. I ended up with a pulmonary embolism, I ended up with DVTs. So here we are, sitting and speaking to you. Big thing.
I started paying more attention because I knew I was breathless and I knew I was like lightheaded and getting tunnel vision. I knew that things weren't right, but I didn't realize that how fast my heart was going with it. Yeah, the amount of times I've been minding my own business and it comes up and people are like, well, you probably had these issues beforehand. I'm like, nope, never felt like this before.
Originally, we're cardiac and pulmonary rehab, so we work with people who have lung and heart problems, and COVID is something that has been affecting both of those things. And so we just kind of started integrating these patients and their post-COVID symptoms into our pulmonary rehab program. And it was kind of a weird thing because they really didn't have any of the typical, like not a post-CABG, not a stent patient, not COPD, but it's like, hey, they're on oxygen and they're still having these breathing problems, so they need pulmonary rehab.
Like I remember they started me here at 2.7 miles per hour on the treadmill. And I was like, I don't walk that slow. In general, I was bumping the front and just looking back at them like, guys, I hate this. So, I've had to learn to slow down. That's hard because I'm 24 and I shouldn't have to in my mind, but we have reframed that for sure.
Here, they offer a lot, and having a nurse, an RN, and a respiratory therapist, great, because they're there for, multi-purposes, and, they're constantly evaluating, checking blood pressures, checking your pulse ox throughout the entire day that you're here, the hours that you're here.
If somebody's just struggling, if they come home, they're still on oxygen, or even if they're not on oxygen, but still experiencing other symptoms like shortness of breath, major fatigue problems, they're gonna probably wanna be in a setting with nurses and respiratory therapists so that they can watch them. We teach them, again, to self-assess, to mind their own symptoms, know when to stop, know when to progress, and then help them to go out on their own and be independent with their activity. So far, I really haven't had an experience with a patient that hasn't really gotten better. It's a slow progression, but we are seeing some really good improvement.
It's made a difference, and I know that they all care. And I mean, it's helped, and I think it will continue to help. And even if it doesn't, the fact that I've gotten to this point is pretty good, because what I was doing at home, I was working out still, but my heart rate was like 180s, 190s, and they were like, no, you can't do that. And I was like, I thought if I just worked hard enough that it would kind of go away. And they're like, no, you're giving yourself a stress test. So things that I didn't know and I maybe should have known, they've been able to teach me. And so regardless of if I get a lot better or if this is the furthest that I make it in getting better, this has been very helpful.
This is all new. This is all new. Traveled and did what I want, and that's a goal, to be able to get through the pulmonary process, to build my lungs up. that I'm not having to carry a bigger oxygen tank, that I can use a portable oxygen tank that's allowed on the airlines. So when I walk around this track, I envision airport.